Bismillahirrahmanirrahim. Assalamu alaikum. I'm Dr. Fakhsheena Anjum, Associate Professor at Faculty of Pharmaceutical Sciences, Dow College of Pharmacy, Dow University of Health Sciences. Recording start हुई है ना? ठीक है. Received some questions on contraception, so I'll start responding one by one towards your questions. When are extended or continuous regime given? If there is no menstruation, so what are the possible adverse effects? Well, continuous use birth control is when you take active hormones for a year or longer with no breaks. Because you do not stop taking active hormones, you do not have withdrawal bleeding. Extended use birth control is when you extend the amount of the time you take active hormones to longer than the typical 21 days. And for better understanding of these things, you can use the links that I have provided to you. Then the next question is, what are mineral oil drug preparations and how do they affect condoms? Okay, mineral oils are used as lubricants as part of some preparations. Also, they are employed like in creams, lotions, and ointments. And sometimes they are used also in antifungal creams for candida infections. These products, they can damage the latex rubber condoms within 60 seconds, causing the defects which may allow the passage of sperm or the microorganisms. And there is no deterioration with glycerol, which is a frequent component of hand lotions and personal lubricants, or with aqueous nonoxynol 9, which is the most commonly used spermicide. Then the next question is, what are the lowest doses of hormonal contraceptives with their brand names? So if I talk about the United States, presently the lowest effective estrogen dose available as a combination oral contraceptive is 20 microgram of ethinyl estradiol with different progestins, and 20 micrograms of ethinyl estradiol coupled with levonorgestrel results in fewer side effects and cycle control when compared with higher dose pills. You can check the links also that I have provided. Check the given links, please. Now the next question is, we come to know about adverse effects of hormonal contraceptives from their symptoms as estrogen and progesterone excess or deficiency, or do we have to measure hormone levels? Okay, as far as the adverse effects or side effects are concerned, they are common and they vary from person to person. And to test the hormone levels, a blood test is one of the most common ways. Apart from that, urine, saliva, or blood can be used to test the estrogen. There are 4 factors that should be given consideration when selecting a contraceptive method, like relationship factors including marital status, how often you have sex, and partner preferences, then the religious beliefs, differences between birth control methods, including how effective they are at preventing pregnancy, side effects, cost also, and whether they prevent sexually transmitted infections or not. So these things have to be considered, and please also see the provided links for further clarity. We give injection depot medroxyprogesterone acetate for a duration of 3 months. When does withdrawal bleeding occur? Okay, unacceptable spotting and bleeding may occur. Things vary from person to person. You can check the links, please, for the reference. Next question is, we insert vaginal ring for a 3-week period with 1 week lapse. Is there any withdrawal bleeding? Well, we have to wait 1 week to insert a new ring. Withdrawal bleeding usually begins 2 to 3 days after removing the ring, and there may still be bleeding when you insert the new ring. Okay, so for further reference, links are given to you. Patches are inserted every week for 3 weeks. Do they have withdrawal bleeding? During patch-free week, there is a withdrawal bleed like a period, although this may not always happen. See the links, please. When does withdrawal bleeding occurs in implant and Mirena? As you know that withdrawal bleeding is an expected effect of some form of hormonal birth control. After stopping hormonal birth control, most women will have withdrawal bleeding within 2 to 4 weeks. After this withdrawal bleeding, natural menstrual period should come back itself the following month. This period will be heavier and longer than the withdrawal bleeding. Check the links, please. Next question is, after vasectomy and tubal ligation, how much time is needed for contraception? To be able to have children after a vasectomy, one can undergo a vasectomy reversal or try in vitro fertilization and intracytoplasmic sperm injection using aspirated sperm. Tubal sterilization is more than 99% effective in preventing pregnancy, and after this procedure, one does not need to take birth control to protect from pregnancy. Both tubal ligation in women and vasectomy in men, they are one-time procedures that are safe, inexpensive, and relatively straightforward to do for a trained person. Sterilization does not require constant use of a contraceptive method, as you know, and regular visits, they're not required to the health facilities or repeated expenditure on contraceptive supplies. Although sterilization procedures, they usually demand a greater investment in skill, training, and equipment than the temporary methods of contraception, they provide lifelong protection against pregnancy and are therefore more cost effective. Can check the link also. I always provide the links for the references. Then the next question is how we decrease or increase progestin and estrogen content in combined estrogen-progesterone contraception. Okay. For use of such medications, the blood pressure, weight, and the medical history of the patients, including the medications, they should be reviewed first. And the concerns and preferences of patients can help to determine which combination birth control pill is right for them. Generally, recommended pills with the lowest dose of hormones that will help prevent pregnancy, they are recommended to give important non-contraceptive benefits and minimize the side effects. Although the amount of estrogen in combination pills can be as low as 10 micrograms of ethinyl estradiol, most pills contain about 35 micrograms. Low-dose pills can result in more breakthrough bleeding than the pills with more estrogen. And combination pills are categorized based on whether the dose of hormone stays the same or varies. They can be monophasic, biphasic, or triphasic. Monophasic means each active pill contains the same amount of estrogen and progestin. Biphasic means active pills contain 2 combinations of estrogen and progestin. Whereas the triphasic means that active pill contains 3 combinations of estrogen and progestin. In some types, the progestin content increases. In others, the progestin, the dose, it remains steady, and the estrogen content increases. So for more details, you can see the links. Next question is, some emergency contraceptive pills like ECPs, they are available in Pakistan. What alternative can be given for emergency contraception? Okay, an alternative method of emergency contraception is the copper intrauterine device. It is inserted up to 5 days after the egg is released, and it's almost 100% effective. It's more effective if female weighs more than 70 kg. And this copper intrauterine device has the advantage of providing long-term contraception. If one likes it, it can be left in place for years. Next question is, what is the plan for the woman who used ECP and wanted to switch to OCP for further contraception? How to and when to start OCP in this case? Okay. Following the use of ECPs, women may resume or initiate a regular method of contraception. If a copper intrauterine device is used for emergency contraception, no additional contraceptive protection is needed. Following administration of ECPs with the levonorgestrel or combined oral contraceptive pills, women may resume their contraceptive method or start any contraceptive method immediately, including a copper-bearing intrauterine device. Then the next question is, OCPs can be used for other purposes also. If a woman wants to delay periods, like religious reasons, for Hajj or Umrah, what and when to prescribe? Okay. The control of periods usually requires the taking of hormonal medication, which falls into two main categories: the contraceptive hormonal pill and the non-contraceptive hormonal pill. The type to be used is best determined by factors like age, smoking, thrombus risk, cancer history, and contraception need, etc. You have to rule it out. Norepinephrine is effective for prolongation of menstrual bleeding in special events like Hajj and Umrah. Best results are achieved when it is started 15 to 10 days before the next menstrual cycle, and it is given in 15 mg to 20 mg daily dose. That is 3 norepinephrine tablets a day, starting 3 to 4 days before expected date of periods. So this was about your questions regarding contraception.